Good afternoon, Joyce. Good afternoon, classmates. We are Group 8, and with us is Amy Asusana, Lady Gabrekidan, myself, Christine Ignacio, Shamsi Kadim, and Jalibel Lago. We are here to discuss about the mental health issues in the correctional. For our outline topic, we will be discussing the definition of mental health, definition of mental illness, the statistics, mental health issues, who covers mental health services in prisons, mental health strategy, nursing in Canada's federal prison, the nursing roles, inmates' barrier to care, and inmates' mental health treatment statement. Let me first start by defining what is mental health. Mental health, as defined by the Center for Disease Control and Prevention, states that it is a state of well-being in which the individual realizes his or her own abilities and can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. For mental health illness, as defined by the same Center for Disease Control, mental illness is a collective diagnosable mental disorders or health conditions that are characterized by alterations in thinking, mood or behavior, or some combination of this, associated with distress and or impaired functioning. Here is the prevalence rate of current diagnosis for mental health disorders. As you can see, the categories of disorder, and topping the list are the mood disorder, followed by primary psychotic, followed by alcohol or substance use disorder, and then by anxiety disorders, eating disorders, pathological gambling, borderline personality disorder, and the antisocial personality disorder. In this table, you can see the statistics of mental health disorders in Ontario, the Atlantic part of Canada, and the Pacific part of Canada. Now I'm passing you on to Jolly to discuss further on mental health issues.
Hi Joyce, hi everyone. My name is Jolly and I'm going to discuss about mental health issues in Canada. So I'm going to discuss about the mental health issues in men. And over 40% of offenders met the criteria for a current diagnosis of substance abuse of antisocial personality disorder. As we all know that antisocial personality disorder is a mental health condition that causes patterns of manipulation and violation of others around them. And this condition overwhelms the personality as well. And second, the lifetime prevalence rate of alcohol dependence, another common disorder, is more than twice as high in men and women. And in developed countries, men, 1 out of 5 men and 1 out of 12 women develop alcohol dependence during their lives. Men are also more than 3 times more likely to be diagnosed with antisocial personality disorder than women. And men are more likely than women to disclose problems with alcohol use to their healthcare provider. Next, the mental health issues in women. Depressive disorders account for close to 41.9% of the disability from neuropsychiatric disorders among women compared to 29.3% among men. And because women ruminate more frequently than men, focusing repetitively to their negative emotions and behaviors, rather than engaging to active problem solving. And depression, anxiety, psychological distress, sexual violence, domestic violence, and escalating rate of substance use affect women to greater extent than men. And women with an anxiety disorder are more likely internalized emotions, which typically result to withdrawal, loneliness, and depression. And pressures created by their multiple roles, gender, discrimination, and associated factor of poverty, hunger, malnutrition, overwork, domestic violence, and sexual abuse combine to women's poor mental health as well. And Aboriginal women had higher rates of alcohol, marijuana, amphetamines, and sedative dependence. So, in summarize with this, the difference of mental health issues in women and men is that men is more likely to develop substance abuse and anxiety, while women are more prone on depression and anxiety as well. So, who covers mental health services in prison? So, federal and provincial offenders are not covered through the Canada Health Act, Health Canada, or any provincial territorial health agencies. And Correctional Service of Canada has the sole responsibility to provide health services of all kinds of federal inmates. This is from Correctional Service Canada 2014. Thank you. And Amy will going to discuss about the mental health strategies.
So I'm Amy Azuzana, and I am going to discuss the mental health strategy for corrections in Canada. So the Correctional Service of Canada, through the implementation of its mental health strategy, is actively improving the continuum of mental health care provided to offenders by building capacity in federal institutions and providing programs to support offenders' safe return to the community. The mental health strategy for corrections in Canada is comprised of two parts: the framework and the So the mental health strategy for corrections in Canada is comprised of two parts: the framework and the strategic priorities. The framework forms the foundation for the strategic priorities and the implementation of actions required to realize the expected outcomes as described for each of the 7 key elements, which are the mental health promotion, screening and assessment, treatment, services and support, suicide and self-injury prevention and management, transitional services and support, staff education, training and support, community support, and partnerships. So the mental health promotion, the effective delivery of mental health services along the continuum of care is realized in an environment that promotes wellness, prevent illness, and makes effort to reduce the stigma. Screening and assessment, the early identification and ongoing assessment of mental health needs of individuals is essential for providing appropriate support and treatment for those who are at risk of harming themselves or others, for commencing timely treatment, and for informing placement and correctional planning. The treatment services and support, a range of appropriate and effective mental health treatment and adjunct services is essential to alleviate symptoms, including the risk for self-injury and suicide, enhance recovery and well-being, enable individuals to actively participate in correctional programs, and for safer integration of individuals with mental health problems or mental illnesses into institutional and community environments. The suicide and self-injury prevention and management, it is a comprehensive approach to the prevention and management of suicide and self-injury is essential for managing the increased risk of suicide and self-injurious behavior among individuals in the correctional system. Early identification of risk for suicide or self-injury is important in establishing mental health treatment, monitoring and support plans, as well as for placement considerations. Staff are trained to identify symptoms and factors that may indicate an elevated risk for suicide or self-injury and to intervene appropriately. The transitional services and support, the dedicated transitional services are required to support the seamless continuity of care from the community to the correctional service upon return to the community. These services will be provided during the pre-sentence period, at the time of intake, within and between institutions, and upon release to the community, with an emphasis on connecting with community and resources. staff education, training, and support. The staff are required ongoing support as well as comprehensive education and training in mental health to enhance their well-being, knowledge and skills to interact effectively, and provide appropriate support for individuals with mental health problems and or mental illnesses. And last is the community supports and partnerships. Outreach initiatives to build relationships with partners are essential to optimize individual mental health and well-being, enhance continuum of care, and contribute to the shared responsibility of public safety. In conclusion, the focus of the framework is to ensure that when individuals with mental health problems and or mental illnesses are involved with the correctional system, an emphasis is placed on providing an opportunity to engage these individuals to ensure continuity of established treatment plans, to develop and implement new treatment plans, and to integrate the mental health services received in correctional settings with community-based treatment and follow-up services. The strategic priorities identify the priority areas for work over the next 5 years in order to improve all jurisdictions' performance against the key elements, which are the knowledge generation and sharing, enhanced service delivery, improved human resource management, and building community supports and partnerships. So in knowledge generation and sharing, knowledge is generated through ongoing research of international and national best and promising practices in the area of mental health and the law. The generation and subsequent sharing of knowledge leads to effectiveness in the other areas of this strategy, specifically enhancement of service delivery, improved human resource management, and building community supports and partnerships. Enhanced service delivery. Service delivery refers to the activities throughout the continuum of care, including the screening and assessment, treatment, support and services, suicide and self-injury prevention and management, transitional services and supports, and community supports and partnerships. Improved human resource management refers to the ongoing support, education, and training in mental health to enhance staff well-being and the knowledge and skills to interact effectively with individuals with mental health problems and or mental health illnesses. Building community supports and partnerships refers to the activities that support a seamless continuum of care through building relationships with partners to optimize individual mental health and well-being while contributing to the shared responsibility of public safety. In conclusion, the strategic priorities are an ambitious multi-year undertaking. There will be variations in the initiation and completion of the identified plans and expected outcomes dependent upon the capacity of the respective correctional jurisdictions. Specific plans for each of the strategic priorities will be identified annually. So the priorities are mental health screening and assessment upon admission, primary mental health care in all institutions, intermediate mental health care units, regional treatment centers, enrichment of mental health support in the community. And the Nursing in Canada's federal prison will be discussed by Lilti.
Hi, my name is Lilti Gabrakidan. I'm discussing about nursing in Canada federal prison. For more than 700 registered nurses working in Canada, 53 federal prisoners providing care is becoming increasingly complex. The role of the nurse at CAC is to provide every inmate with essential health care and reasonable access to non-essential mental health care. This contributes to the inmate rehabilitation and successfully reintegration into the community. Challenge of correction nurses. Nursing in Canada federal prison. Nurses at CAC are more anonymous than average nursing in communities. You are often called up to make your own decision. You're making your own decision based on experience, judgment, and critical assessment skill. You will also work closely with other professionals at CAC with a common goal of making a difference in the life of offenders. Other professionals including psychologists, family physician, recreational, and occupational therapist. Challenge of correctional nurses. Challenge corrections nurses face are ensuring safety and security of all clients, including both correctional staff and inmates at all times prior to healthcare delivery, maintaining dignity, confidentiality, therapy relationships, dealing with complex clients because of client vulnerability due to aging and lack of awareness of health concern, and trying to act the client advocate in correctional setting. Nursing roles. On set 24/7 nursing to meet a volume of medical emergency and complex care needs. Education on the complex ethical and practical issues that arise from providing care in security-based setting. Training to maintain growing mental health issue among the prison population and staff. Improve community support in health and mental health and addiction. Infectious disease prevention and control. Methadone maintain program. Inmate suicide prevention. Identifying the individual need for offenders with mental health disorder and developing discharge plan. Support offenders with mental health disorder under community provision. Thank you. Samshi will be continue bearer of care.
Hi Joyce and everybody. For sure, for care in every health workplace, we have barrier. Especially in this workplace, we have some barrier for care, like delays in diagnosis testing and follow-up treatment, delays in access to especially care and emergency medical treatment, lack of timely medication refills, and lack of regular monitoring and treatment for chronic disease. When prison in need of mental health treatment must be confined in a correctional facility, and they are entitled to have some right, and this right include right. The first one is the right to adequate medical and mental health care, to protection from staff and inmate abuse, the right to informed consent to treatment, the qualified right to refuse treatment, including psychiatric medication, the right to the least restrictive environment and the least intrusive response to an apparent need for mental health services. Mental health services should be available to prisoners 24 hours per day, 7 days per week. And also they have right to confidentiality in the delivery of mental health service and related facility records. They have right to have regular and timely access to medical and mental health staff who are culturally competent and qualified to provide adequate treatment and supervision. And they have right to be transferred to an appropriate medical or mental health facility or unit when conditions warrant. They have right to be free from corporal punishment, chemical restraint, and sexual abuse or correction. Prisoners should have a discharge plan prepared when they enter the correctional facility in order to plan for their eventual integration back into the family and the community. Now we are present, it's finished, but I have a question. I asked this question in this group, and my question is, if you are a registered nurse and you couldn't find a job and your financial status is bad, so that you cannot make your leave, and meanwhile you receive an offer to be hired in a prison with good salary and good promotion, are you accepting this job?
As to your question, if I will be accepting a job in a correction as a nurse, yes or no? Yes, I think I will. We all know that as community health nurses, part of its many role is to work in different settings in the community in which they serve. And that includes the corrections. I think working in a correction is a really challenging job, because you are not only dealing with inmates, but inmates with mental issues. So it will really be a great challenge for a nurse to be working in the institution, in the correction. But I can say that you should really be passionate with your job in order to work in this kind of setting. Passionate in the sense that your heart is really into it. Yes, I think, I mean, in summing it all up, I think I will work because I have the passion, and this role is part of the community health nurse's role. And as a nurse, I will have to be flexible in everything that I do.
I am given the opportunity to work as a correctional nurse in Canada. Maybe I would accept it. In this way, I can able to use my critical thinking abilities and my assessment skills in handling different situations. I know it is very hard and challenging as well, but I think I might love and enjoy this career. And of course, I just need to be mindful of any unexpected situation that would arise. That's it.
Thank you for watching!